Hello, my name is Medina Peebles, and this is my PowerPoint instructional design model for CE 620. So, overview of my model was I chose Merrill's Instructional Design Principles. It is founded by M. David Merrill. He was a noted educational educator and also a noted teacher. And the reason I kind of like this one is because it was very much based on task-based learning. And in the allied health field, I think that task-based learning is real important because we're constantly teaching students how to perform competent tasks. The learning, in order for learning to be effective, David Merrill felt that it needed to be centered on problem solving. And so with that, he developed 5 principles for effective training or instruction. A detailed explanation needs to be given and pretty much address each step of the model. So the first one was learners are focused on learning whenever they're able to solve real world problems. So I used a home health, my training program was a home health agency that was training competent home health aides to perform adequate personal care. So when we think about this, we look at that we pretty much could demonstrate competent personal care and then allow the students or the employees to actually solve things either using critical thinking or scenarios. The second one was existing knowledge is stimulated and learning can be promoted. So once you know that you have that foundation of learning kind of built, then a lot of times you can help them build on each task. For example, they may start out with just maybe assisting the patients to dangle on the side of the bed, and as they learn different transfer techniques for the patient, then they're able to lead up to a personal complete bed bath. The third one was that new knowledge is demonstrated to the learner in action. So basically you're going to show them this is what we want you to be able to complete is a competent personal bed bath, and we're going to demonstrate this to you, and we're going to hopefully help you to be able to perform the task. So basically the fourth one said that learning occurs when the learner can apply the skills to solve problems. So hopefully as the student or the trainees are able to perform the task, then you're going to have the instructor there and you're going to obviously give them good feedback, talk to them about how maybe they could have done that differently or how to position the patient differently or just different techniques. The last one is the new knowledge is implemented into the learner's world. So as we know, basically they're going to take this knowledge that they learned from the training on personal bed baths or competent care on the home health agency in the home, and they're going to basically take this out to the workplace and demonstrate this in practice, demonstrate the task. As far as maybe an image that kind of indicates Merrill's principal instruction, I use this one where we have the problem in the center, which is maybe not competent bed bath or maybe not performing the task at hand correctly, and then we're going to use these things which it could include integration, applying it, activating, and then demonstrating it. Why and how do we think this is best for my training program? Again, I felt like my training program was with home health aides to perform adequate personal care. So I really liked that Merrill's included task-based learning. You take the task, you demonstrate the task, you teach the theory, and then hopefully they're able to practice that in the lab and able to perform that skill. Again, it may start with a small task and lead up to a more complex task, where it may be maybe you're just helping them maybe perform oral care and then lead up to maybe being able to identify skin breakdown. Again, you're going to need to assess the knowledge base of the students. You may have some home health aides who've worked for 10, 15 years and then others who maybe have no knowledge. So you've got to look at that knowledge base and then hopefully help elaborate on that so everybody's on the same level. Demonstrate the skill in the lab area. And then you're also going to allow the aides to demonstrate the skill so that you know that they're effectively performing the skill. Sometimes they can use a peer. When we compare this to Addie, these were just some things that I felt like that maybe Addie didn't do. The first one was that Addie does not allow accommodation to deal with faults during the learning process, where Merrill's did. They kept you engaged in the problem solving so that you were able to hopefully critically think or solve problems. The second one was with Addie creativity, it can be decreased due to the detailed processes. With Merrill's, there was different ways that you could use to teach the concept so that you hopefully was able to maybe give them a better understanding of the task. Addie also uses post-test evaluations, and from all the information, I did not see that Merrill's instructional design used that. The last one, the fourth one is that sometimes ADDIE can be a design that is not focused on identifying changes in behavior. Hopefully, if you're able to change the behavior of the home health aide so they can adequately perform the care, then you're going to see an enhancement as far as patient comfort, and you're also going to see in the family, they're going to feel differently also when their loved one is happier and they're more comfortable. The last one was ADDIE design may not be realistic in analysis up front and fail in areas that could be critical problem solving. Again, with Merrill's, you had active learning going on, you had problem solving, you had critical thinking and scenarios. So that's one of the reasons that I liked instructional with the Merrill's instructional design. 5 reasons why I liked the reasons of demonstrate. They get to actually demonstrate the steps. The second one was apply. They're going to apply their knowledge to solve the task. The third one was activate. So remember, they're going to build on the concept as they go through. They're building on basically their knowledge base. Fourth one was integrate. They're going to take that information. They're going to go into the home. They're going to perform competent level skills in the home health setting. The last one was engage. So they're going to take their skills. Hopefully they're going to build on that. And hopefully they're going to be able to become better home health aides and give better, more competent care. And then lastly, I included my reference list. Thank you so much. This was Medina Peebles. Thank you.